Hi, Dr. Lindsey here. I'm going to take you through a case, or two cases, now 8 years after we first met this fellow, with a small interview. Now, this man has a big color contrast and relatively fine darker hairs, and he came in back in 2015, and we did about a 2,300, 2,400 graft case. He came every day for a few days and then opted to stay at home and really didn't do that good a job cleaning on the 4th, 5th, and 6th days. Just saying he was too nervous to touch it. And if you watch some of my videos, you really have to get the crust and debris off to keep it from pulling out hairs. That's why we offer to come in on the weekends and see patients. Anyhow, he turned out well, but about 2 years later he decided he wanted to do a case a little further back and adjust his hairline a little bit. And we did 2,000 grafts and made him come every day to get clean. He just walked in. It's been a number of years since I've seen him. And he looked quite unremarkable, except you'll note he has a laceration here, I guess, from his cat the night before. He didn't want to show his face, but so you'll see in the interview that he holds a folder up, but there's a laceration here from his cat the night before. I had forgotten that we had done a hair transplant on his dad, who's from upstate New York. And I haven't seen him since the day his stitches came out, although I saw a picture on the phone. He looks fine. Anyhow, he does this little interview, so take a look.
So Steve, how old a fellow are you, sir?
I'm just about to turn 42.
And up to your right is the picture of you when I met you 83 months ago, and we did your first case, and then you came back a few years later and we added a little bit to your hairline like we always do, and then a case in the middle. How's this been for you? Incredible.
I just feel so much more, I have so much more confidence, and I'm just so incredibly thankful. It's incredible looking at the before and after pictures. You're just a complete miracle worker, and I feel so grateful.
Any kind of bullshit I've pulled on you?
No, you've been great.
And I'd forgotten, I worked on your dad too.
Yeah, he's extremely happy too, and he was an older patient, so he is almost 80 now, so he probably did it about when he was 75.
I'm just gonna reach over here and pull on your hair.
Yeah, totally.
It's good coverage, man. It really is.
I'm so pleased with that.
And you're a dude that has a color contrast and relatively fine hair, and you still turned out good. And for people that might see that little scrape, your cat scratched you last night, right? You're not.
Yeah, woke me up at 4:30. My two cats were chasing each other up the headboard, and one used my face as leverage.
Yeah. All right. Well, thank you for this video, and thank you for your business.
Yeah, of course.
So this is an extremely optimistic, not younger anymore, 41-year-old fellow with a color contrast and relatively fine hair, who has gone from having little hair, as shown here, to having an unremarkable appearance from all directions. Here's a close-up of his scar. We do these type of cases all the time, and I guess now we've done a handful of father-son cases. In fact, this past weekend we did a father from LA and a son who came in from Italy. It's kind of fun to work on a whole family together, and I think there's another video where I did the son, the dad, the son again, the uncle, and later the aunt, and then the uncle again. And it's, you get to know people pretty well over the course of a year or two, during which time we do these cases. Do your research. If we can help you, please give us a call. Thanks.